Today we're going to talk about weight loss medications in obese patients and also for patients who are diabetic. So there are so many medications that are available now for patients who are using off market and off prescription through medical spa for the weight loss. Even in India they have semaglutide advertisement. So the common weight loss medications that we use primarily for weight management are phentermine or topiramate, which has been used for patients with seizure disorder, patients with migraine headaches like Topomax. What it does is it decreases the appetite and increases the satiety, meaning you feel full. You don't crave for snacks and unhealthy or restaurant type of fast food foods. And then the most effective medication that we see in weight reduction is phentermine, and you can take that as a lower dose for 15 days and then slowly increase it to the maximum dose only for 60 days. You're going to start doing that with a regular diet and exercise modification. That is the key. The second choice is GLP-1 receptor agonist. So that includes, there's two drugs, semaglutide and liraglutide. These drugs mimics the action of incretin hormone, which is called the GLP-1, and it reduces the gastric emptying time, and also it reduces your appetite. It has shown efficacy in a lot of my patients in the clinic who are obese and also who are diabetic. Since it's a dual benefits, we use it for patients who have uncontrolled diabetes and excessive weight gain, causing lots of joint problem, and they cannot exercise. The third one we use is bupropion or naltrexone. These are combination drugs used when we need like a mood or a motivation to exercise and diet change, used as an antidepressant, anti-anxiety. It works directly on the central nervous system to decrease the appetite and also to decrease the cravings. And then we have tirzepatide, which is a dual GLP-1 and GIP receptor agonist. It shows results in the clinical trials where weight loss is compared with same effect as semaglutide. These are all FDA approved medications. The key factor here is you have to understand medication alone is not going to do the job. You have to have a very strict, meaning low carb, low fat, high protein diet regimen. You have to see a nutritionist and make sure you go through the calorie count. You have a very strict and modified diet regimen, and then you also have to have a very strict exercise. We're not talking vigorous exercise in the gym, but you have to have at least 30 minutes of brisk walking every day. So diet modification, exercise modification, lifestyle changes of not eating any unnecessary unhealthy food, like awareness, and then use of these weight loss drugs. It has studied in Asians, Americans, Japanese, Singaporeans. So this is all over the world now. It's going to be one of the most effective treatment that we give for patients who cannot lose weight with diet and exercise alone. So I find it very beneficial in my clinic on patients who lose 15 pounds in 3 months, 20 pounds in 3 months. We also do blood work because these medications go through your GI and your kidney. So we have to keep an eye on your liver enzymes. We have to keep an eye on your kidney functions. So they have to be seen in the clinic with the lab work of CBC, CMP, kidney functions, at least first 2 rounds, like every 3 months. Then they are on their own. Lots of water is another key. Hydration is the key. I hope you like this video. Thank you. Bye-bye.